I now recognize myself for questions, actually. And again, Dr. Walensky, I want to thank you for being here. And I feel certain that there's much we can learn going forward based on many of your experiences and your predecessors' experiences, that we can come forward with better plans in the future. So on March 28th, the Select Subcommittee sent you a document request regarding the drafting of the CDC's February 2021 school reopening guidance, particularly whether any outside groups exerted uncommon influence over the process. On April 26th, the Select Subcommittee held a hearing with the President of the American Federation of Teachers, Mrs. Randy Weingarten. Then on June 1, after 2 months of the CDC failing to produce a single document, we had to follow up on our March 28th letter. So this investigation is a priority to the Select Subcommittee, as you can imagine. And today, all we expect is honesty. And do you commit, as the director of the CDC and speaking for the CDC, to fully cooperate with the document requests?
I certainly commit. I know we have been working with you, and I commit to working with HHS and to working with you to act in good faith and get you the documents that we can.
I appreciate that. We do need to see them. And do you commit, as director of the CDC and speaking for the CDC, to make employees available for transcribed interviews?
Again, this is something I commit to working with CDC in good faith efforts to do our best to get you the information and talk to people that you request.
It's really important. It's really important to talk to people that were in the trenches and to understand what was going on, good, bad, or indifferent. So a large part of this investigation is whether the teachers' unions or other political groups receive preferential treatment from the CDC or the Biden administration, and if these groups advocated for measures that would unscientifically keep schools shuttered. That's a concern. So I'm going to ask a series of questions. And I know this is sometimes challenging to just answer something yes or no, but I'm going to ask you to do that if you would. Director Walensky, did the American Federation of Teachers provide suggested edits to the CDC's February 2021 school opening guidance, including a trigger to automatically close schools that, if implemented, would have kept more schools closed and kids out of the classroom?
The AFT was interested in having closure triggers. That is my understanding, yes.
So your answer is yes?
Yes, but they were not accepted, of course.
I understand.
Our full goal was getting the schools open, and there was not a scientific, I mean, if you recognize in our guidance, we had layered mitigation strategies to keep our schools open. This was all about keeping schools open. This was not about triggers to close them.
I appreciate that. Did the AFT's suggested closure trigger run contrary to the prevailing science and data at that time?
Again, this was something where we had layered mitigations to strategies in the operational guidance to keep our schools open. This was, again, it was all very locally based, you know, depending on local community transmission, et cetera. But again, our goal was not to talk about school closure triggers. Our goal in this guidance was to keep them open. And
I appreciate what you just said about what's going on locally, because I think that's one of the real lessons learned here, because in medicine in particular, you had counties with no cases whatsoever and people were being denied their medical care. So there were a lot of things to consider there. And I appreciate that you didn't accept one of the things, because in my mind, the science and the data was contrary to some of those, the trigger, if you would. And to be clear, though, the CDC did not implement a closure trigger that the AFT advocated for, correct?
Correct.
All right, thank you very much. Because it was unwarranted, correct?
Because that was not the goal of the guidance. The goal of the guidance was to get schools open and to keep them open. That was not where we were looking. Just to keep in mind, this was January 2021. Many of the schools were closed. This is what I inherited, what I stepped into. My kids were home with me. The whole point was safe reopening, remaining reopening of schools.
No, I'm with you, and I remember January 2021 quite well, and I have children also, grade school children, so I get it. But I want to shift to the statement you made on February 3rd, 2021. You stated, there is increasing data to suggest that schools can safely reopen, and that safe reopening does not suggest that teachers need to be vaccinated. Vaccinations of teachers is not a prerequisite for safely reopening schools, end quote. The same day, the White House stated that you were speaking in your personal capacity, quote, end quote, on personal capacity. So again, just yes or no, were you speaking in your personal capacity when you made that statement?
Whenever I have been speaking to Congress, to the media, at press conferences during my tenure at CDC, I have been speaking in my professional capacity.
Thank you. Was that your position based off the available science and your own knowledge and experience?
Just to be clear, there were limited amounts of vaccine doses at the time. There was a prioritization ultimately several weeks later for teachers to get vaccinated, but I didn't think teacher vaccination, if we had all of the other five layers of mitigation strategies available, that was not the only thing that needed to keep schools closed. That was, the schools could open without teachers being vaccinated. And there were data and literature. People in healthcare were working already.
Many people were
Yes,
working.
many people were working.
Why do you think the White House contradicted you then, or tried to change it from professional to personal?
That is something I can't speculate to. I think you'll have to ask them.
That's fair. On June 21, 2021, President Biden stated, quote, "If you are vaccinated, you're not going to be hospitalized. You are not going to be in the intensive care unit. You are not going to die," end quote. Again, simply yes or no. By that date, were there vaccinated Americans that were hospitalized?
What I can tell you is at the time, CDC was releasing increasing data showing the immense protection of vaccines against severe disease, hospitalization, and death.
But by that date, were there vaccinated Americans that were hospitalized?
Maybe I will say this. We still, to this day, do not have data on people who are coming into the hospitals who are vaccinated. That is a data point that we have lacked.
Well, I appreciate you saying that, because that is another thing that we need to look into very closely and to do better going forward.
On our data system.
But I will say this, believe me, as a physician, I was watching what was going on. We were first looking out to try and see how do we treat this thing? What is going on? What blood work can we do? IL-6. Your inflammatory markers, CT of the lungs, there were no tests. And we were trying to find answers, but we did pay very close attention to the trials of Operation Warp Speed. And it was fascinating to, be a part of that in some way. We would meet with Dr. Fauci, Dr. Collins, et cetera. But we knew from the trials the people that got vaccinated still got COVID. In general, they didn't get as sick, and they were less likely to be hospitalized, and therefore less likely to die. But it was still happening. So I'll ask you the question, to the best of your knowledge, had any passed away? When he made that statement in June of 2021.
If I might, Dr. Wenstrup, let me just also thank you for your work in promoting vaccination. Many videos of you doing vaccine clinics yourself. So I want to thank you for your efforts there. It was much, what I will say is my understanding of the initial clinical trials that were released in November, December, before I became CDC director, was 96% protection against symptomatic disease. In medicine, we never say never. But
exactly. Exactly. So thank you. And that's the problem I have with this statement from the leader of the free world, is to say something so definitive. You're not going to be hospitalized. Even in the trials, people were hospitalized. You're not going to the ICU, as a definitive statement. That was misinformation. That was divisive. That was dangerous. And it put you in a very hard spot. It put you in a very hard spot, as you are to be the leading voice for America. And I applaud so many of the things that you have done and did do. But this is a problem, and that's the point I'm trying to make, that we cannot let this happen. We have to let science be the science. And in my opinion, we should have been hearing from the doctors who treated COVID patients, not politicians, not someone in the lab. So one more question. So just to be honest, we know the vaccination saved lives. We know it's not perfect, but there were breakthrough cases and there were deaths, and we have to do better going forward. I now recognize the ranking member of the full committee.